Optimum nutrition during the first 1000 days of life, including intrauterine period, is a unique period of opportunity when the foundations of optimum health, growth, and neurodevelopment across the lifespan can be established. The fact that the reproductive cycle includes breastfeeding and pregnancy has largely been neglected, leading to the assumption that breast milk can be replaced with artificial products without detrimental consequences. Hi, I'm Dr. Radha, and I'm here to talk about the benefits of breastfeeding. Findings from epidemiological and biological studies substantiate the fact that the decision to not breastfeed a child has a major long-term effects on health, nutrition, and the development of child and on the woman's health. Possibly, no other health behavior can affect such varied outcomes in two individuals who are involved, the mother and the child. Formula milk is just a food, whereas breast milk is a complex, living, nutritional fluid that contains antibodies, enzymes, and hormones, all of which have health benefits. Breast milk is the natural and optimum exclusive food for infants at least up to the age of 6 months. Human milk is uniquely suited to the human infant, both in its nutritional composition and in the non-nutritive bioactive factors that promote survival and healthy development. The mean macronutrient composition of mature term milk is approximately 0.9 to 1.2 grams per 100 ml of protein, 3.2 to 3.6 grams per 100 ml of fat, and 6.7 to 7.8 grams per 100 ml of lactose. Energy estimates range from 65 to 70 kilocalories per 100 ml and are highly correlated with the fat content of human milk. The proteins of human milk are divided into the whey and casein fractions, with each comprised by a remarkable array of specific proteins and peptides. The most abundant protein are casein, alpha-lactoalbumin, lactoferrin, secretory immunoglobulin IgA, lysozyme, and serum albumin. Non-protein nitrogen-containing compounds include urea, uric acid, creatine, creatinine, amino acids, nucleotides, which comprise around 25% of human milk nitrogen. Protein levels decrease in human milk over the first 4 to 6 weeks or more of life, regardless of timing of delivery. Milk protein concentration is not affected by maternal diet, but increases with maternal body weight for height and decreases in mothers producing higher amounts of milk. The study by Zhang identified a total of 247 proteins, of which 200 were quantified, where 65, that is 25%, were immune proteins. The results also indicate that the difference in milk proteome between individual mothers are more related to the quantitative level than qualitative level. The correlation between the changes of milk proteins and the gradual maturation of the gastrointestinal tract and immune system in infants contributes to a better understanding of the biological functions of human milk proteins for growth and development of infants. Breast milk fat is characterized by high contents of palmitic and oleic acids. Fat is most highly variable macronutrient of milk. The fatty acid profile of human milk varies in relation to maternal diet, particularly in the long-chain polyunsaturated fatty acids. The principal sugar in human milk is disaccharide lactose. The concentration of lactose in human milk is the least variable of macronutrients, but higher concentrations of lactose are found in milk of mothers producing higher quantities of milk. Breast milk provides the normative standard for infant nutrition. Nevertheless, many micronutrients vary in human milk depending on the maternal diet and body stores, including vitamins A, B1, B2, B6, B12, D, and iodine. The maternal diet is not always optimal, thus continuing multivitamin during lactation is recommended. Regardless of maternal diet, vitamin K is extremely low in human milk, and thus the American Academy of Pediatrics recommends an injection of this vitamin to avoid hemorrhagic disease of the newborn. Vitamin D also occurs in low quantities in human milk, particularly with low maternal exposure to sunlight. Unfavorable effects of neonatal immunodeficiency are limited by some naturally occurring compensatory mechanisms such as the introduction of protective immunological components of human milk in the infant. Breastfeeding maintains the maternal fetal immunological link. After birth, may favor the transmission of immunocompetence from the mother to her infant and is considered as an important contributory factor to the neonatal immune defense system during delicate and crucial period of immune development. Several studies have reported that breastfeeding, because of the antimicrobial activity against several virus, bacteria and protozoa, may reduce the incidence of infections in infants. The protection from infections may be ensured either passively by factors with anti-infective, hormonal, enzymatic, trophic and bioactivity present in breast milk, or through a modulator effect on the neonatal immune system excreted by cells, cytokines and other immune agents in human milk. Optimal duration of feeding. The World Health Organization recommends exclusive breastfeeding in the first 6 months and continuation of breastfeeding for 2 years and beyond. Children who are breastfed for longer periods have lower infections, morbidity and mortality, fewer dental malocclusions and higher intelligence than those who are breastfed for shorter periods or not breastfed. This inequality persists until later in life. Growing incidence also suggests that breastfeeding might protect against overweight and diabetes later in life. Breastfeeding benefits mothers too. It can prevent breast cancer, improve birth spacing, and might reduce a woman's risk of diabetes and ovarian cancer. A point to be noted is that high-income countries have shorter breastfeeding duration than do low-income and middle-income countries. The scaling up of breastfeeding can prevent an estimated of 823,000 child deaths and 20,000 breast cancer deaths every year. Findings from studies done with modern biological techniques characterize breast milk as a personalized medicine for infants. Breastfeeding promotion is important in both rich and poor countries alike and might contribute to achievement of the Sustainable Development Goals. Multifactorial determinants of breastfeeding need supportive measures at many levels, from legal and policy directives to social attitudes and values, women's work and employment conditions, and healthcare services to enable women to breastfeed and to protect, promote and support breastfeeding. Thank you.